Hi, I'm Sylvia Azania, and in this video, we'll talk about hypospermia or low ejaculate volume. We'll discuss what hypospermia is, its possible causes, if it affects male fertility, possible treatments, and we'll give some tips to try to increase semen volume. And we'll also answer some of the most frequent questions that users may have related to this topic. Hypospermia is defined as a low volume of ejaculated semen. Taken into account the reference values of the World Health Organization, hypospermia is diagnosed when the male has a semen volume of less than 1.5 milliliters. The test performed to determine semen volume and diagnose if hypospermia or any other semen quality problem exists is the seminogram. Semen volume is considered normal when it's between 1.5 and 6 milliliters. And here it's important to mention that even though the World Health Organization published a new edition of the Laboratory Manual for the Examination and Processing of Human Semen in 2021, the truth is that it's most common to still follow the criteria of the previous edition from 2010. On the other hand, when the semen volume is very low, that is, when there's practically no ejaculate, we're facing a case of aspermia. Normally, this is due to an obstruction, or to retrograde ejaculation. And before continuing with the content of this video, I'm going to ask you, please, if you're liking it, give it a like and subscribe to the channel. If you haven't already, as it helps us a lot to continue, and so that all the information we publish can reach more people. The decrease in semen production in males is usually related to two organs, mainly the vesicles and the prostate. It must also be taken into account that semen volume decreases little by little over the years due to the aging of the male. This is a natural process and is not related to any disease. On the other hand, hypospermia can be caused by the following factors. Partial retrograde ejaculation. The semen goes toward the bladder instead of toward the outside when ejaculation takes place. Absence of the vas deferens in seminal vesicles as a consequence of a disease of genetic origin. Obstruction of the ejaculatory ducts, for example, due to inflammation or infection. Androgenic insufficiency due to a deficit of sex hormones such as testosterone. Sympathetic denervation, which is the loss of nerve impulses that reach the penis. Ejaculating frequently, a depletion of sperm occurs until the semen volume is recovered again. And bladder neck surgery in patients who have problems urinating. On the other hand, men who smoke or are overweight could also present a lower ejaculate volume. In any case, the urologist should evaluate possible cases of hypospermia with the aim of identifying more serious complications that could be going unnoticed. To correctly evaluate the seminal quality in a semen analysis, the patient must arrive with a sexual abstinence of 2 to 5 days. If there are fewer days of abstinence and the semen volume is lower than normal, it's possible that the hypospermia is due to a recent ejaculation and not to any major problems. Likewise, it is essential that the seminal sample is collected in its entirety. If any part of the ejaculate has been lost, it's essential to inform the lab since the collected volume doesn't represent the total volume of the ejaculate. On the other hand, it's true that if a man has a low ejaculate, the total sperm count in the ejaculate may be lower than that of another man without hypospermia. Although hypospermia is most often related to oligospermia or low sperm concentration, this is not always the case. It can happen that the sperm count per milliliter is good and that they show adequate morphology and motility. Therefore, having hypospermia doesn't necessarily mean there's an infertility problem if the concentration, motility, and morphology of the sperm are adequate. However, if when seeking pregnancy, hypospermia delays or prevents this goal, a lifestyle change could be tried or assisted reproduction techniques used. There is no definitive treatment that favors the production of a larger amount of semen. However, healthy habits like a good diet, varied and rich in vegetables and fruits, staying well hydrated, and avoiding tobacco and alcohol can help increase the amount of ejaculate in mild cases where lifestyle may be affecting seminal volume. If the lack of seminal volume is caused by a condition in the seminal vesicle or the prostate, the urologist will indicate the most appropriate treatment according to the condition. If the semen analysis diagnoses another seminal problem besides hypospermia, such as low concentration, oligospermia, poor motility, acetospermia, or morphological alterations, teratospermia, in the sperm, the probability of achieving pregnancy naturally will be further reduced. Therefore, if the couple has been trying to get pregnant for more than 12 months, or 6 months if the woman is over 35 or 38 years old, it would be advisable to resort to assisted reproduction techniques such as artificial insemination or in vitro fertilization, IVF. There is no specific treatment that allows for an increase in semen production. However, making some lifestyle changes can help when it is affecting the quality of the semen. The recommendations would be these: follow a balanced diet, drink at least 2 liters of water a day, practice moderate sport regularly, avoid stress, avoid alcohol, tobacco, or other drugs, and don't wear tight clothing in the genital area. On the other hand, eating foods rich in zinc can also be beneficial for seminal volume. However, it's important to keep in mind that these tips can help improve the amount of ejaculate. When there's no more serious underlying cause producing the hypospermia, which may require specific treatment. And now we're going to answer some of the most frequent questions that users may have related to this topic. Can low ejaculation be due to having ejaculated previously? Yes, when a small amount or low volume is ejaculated, hypospermia, it may be because of a previous ejaculation without leaving enough time for the seminal volume to recover. Therefore, when a seminogram is going to be performed, an ejaculatory abstinence of about 2 to 3 days is recommended to correctly assess seminal quality. Similarly, when trying to get pregnant, it's recommended to have sexual intercourse on alternate days around the time of the woman's ovulation to allow time for the seminal quality to recover. Is it normal to have low ejaculation power? It's possible that the power or force in the ejaculate is affected as the man's age increases, just as the volume of ejaculate may be reduced. Likewise, leading an unhealthy lifestyle can also affect the quality of the semen. What are the symptoms of retrograde ejaculation? When a man suffers from retrograde ejaculation, the ejaculated semen won't come out through the penis, but instead goes toward the bladder. Therefore, there may be symptoms such as absence of ejaculate or low volume of ejaculate, and cloudy-looking urine after sexual intercourse, since it contains the semen. However, it's important to mention that retrograde ejaculation doesn't imply that the man has erection problems. We'd like to know about your experience, so I encourage you to tell us about it in the comments.